Education is the key to a bright future.
Good afternoon. I'm Dr. Shegufta. Maybe you all have seen the video in the YouTube, and I'm presenting from Geneva. We are going to discuss about oral health, and we are going to highlight some points where the oral health is being hampered by the lifestyle and the choices we make at this vulnerable age, especially. I can see a lot of people here, and can anyone put up their hands? Okay, nobody smoked. All right. And then that's a very good thing, because we are going to discuss about tobacco users. In my lifetime, I'm a dentist. I have worked with a lot of patients. I have worked with African peoples. I have worked with Asian peoples. But the main problem we have seen, and also European peoples, what I can understand by looking at their tooth is that if he is a tobacco user or not, if he's a smoker or not. Tell me, ask me why. Anyone want to know why? How I can understand? Because of their tooth stains. Those people who continuously smoke, they have bad stain on their tooth. That is the first problem we call psychosocial problem. Because when you have stains on your tooth and you speak with other people, they look onto your eyes, they look onto your stained tooth, and you feel a bit of embarrassed, don't you? Yes, we do. We do feel embarrassed when we have stains in our tooth, when we have bad breath. Our breath doesn't smell good. Every time we feel embarrassed. Okay, we feel that somebody is looking at it and they're saying or they're feeling that I'm not cleaning my tooth enough. That is the main point. We feel bad about it. And also, if we have black tooth with caries, and also if we have lost tooth, like we have 5 tooth here, missing here, no tooth here, then we feel bad, okay? Because everybody stare at us. They're looking at us. We feel bad. So that is why we need to think, are we going to choose tobacco, smoking, or are we going to choose our nice, clean teeth and a big, nice smile? All right. So we want teeth that is white, nice and clean. And so to do that, we have to clean our tooth every day 2 times, in the morning and also before going to sleep. In the morning, I would say if we brush our teeth, I feel fresh, I feel confident, and I got the good spirit to go for my work. That is more important. But in the night, before going to bed, we need to clean it, because all the night, the diseases and the germs, they work inside our mouth. So if we keep it clean before going to sleep, this 6 to 8 to 10 hours of sleep, it is all protected. So I suggest we brush our tooth 2 times daily. Okay? All right then. So if we clean our tooth, we maintain our oral hygiene, but still there is another problem. If we are smoking, then we have stains and other issues. Also, when we smoke, the continuous smoke creates some problem with our gums. What happens? The blood circulation in the gum goes low, and then the tooth becomes slowly movable. It starts moving. Our gums, gingiva, they are not that strong enough. The blood circulation is not good. Then slowly, they move. And what happens? Before getting old, we look like grandmothers, okay? And grandfathers, and we don't want that, okay? So we have to stop smoking. We have to make a good choice. What good choice can we make? We can eat fresh fruit rather than smoking, all right? We can eat banana, apple, rather than smoking, all right? So we have got a point. We are not going to smoke. we're going to eat fresh fruit with the alcohol. It's an acidic drink. Okay, when you go through the video, you will see I have posted 2 pictures about different type of drinks. Among them, with the pictures of the drinks, there are the emojis. Some emojis are sad, like this, and some emojis are smiling. Only the water and the milk and fresh fruits are good for our oral health. Okay, but when we take acidic drinks like cold drinks, like wine, beers, and all these things, they erode the enamel. You know, the first unit of oral health we discussed about the different structures of tooth. There I discussed a little bit about the enamel of tooth, which is the strongest structure. But it protects us and it makes our tooth very functional. But when we continuously drink hard drinks, alcohols, the surface of the tooth, which is enamel, it becomes lost and the tooth becomes weak. It tries to break up and sometimes it becomes so sensitive that you cannot drink cold water even. I understand in Zimbabwe you have a hot weather. Very warm, I guess. Okay, I have been to Papua New Guinea and it's warm, very warm and hot and sunny. And what I like to drink there? Chilled pineapple juice. But guess what? When you are consuming a lot of alcohol and your tooth becomes sensitive, if you say sip a little bit of this pineapple juice, which is chilled, when we take drugs, there are different chemical reactions that happen in our mouth because these drugs are quite chemical things. And also, they hamper the hormonal balance of our body. Okay, so these things create the oral environment not friendly for a good oral health. So we have different issues with our tooth, our periodontium, and everything. You can go deeper and deeper in the slides and also the references, and you can read more about it. Another indirect thing that happens is when we take different sorts of drugs, these drugs makes us craving for sugar. Sugar means not only teaspoons of sugar. Sugar means sugary food like cakes, pastries, sugary drinks, cold drinks, Pepsi, Coca-Cola. I know you like it. Okay, so all these things are sugary things. And after taking these drugs, we have this craving for sugar, and then we take a lot of sugar, and which is not good for our tooth because the sugar are associated with our dental decay. It causes caries and other different sorts of dental problems. And it is also not good for our periodontium. So altogether, this is one of the direct effects. And also we have another indirect effect. When we are taking alcohol, when we are taking different marijuana, cannabis, and all these things, our brains, it's not working properly. We have hallucinations. And like I mentioned, in the hospital, I was having vertigo and I was feeling different. And at that time, we don't have the brain functioning properly. So what we do, we get into fighting. It has a very, very, very crucial thing, very, very hazardous effect. It can cause a lot of cancer in your mouth. And also precancerous lesions. These precancerous lesions, what they do? They create some wound inside your mouth, kind of like an ulcer, and then later it becomes cancer. And then what happens? You have to cut out, operate your tongue out of the mouth. And I have seen a lot of people with deformed face because the cancer was here, they had to cut it out. And with that, the face became like this. It doesn't look good. So I have seen a lot of horrible faces just because of cancer. And how the cancer became like this big? because he was smoking. He was taking a lot of alcohol. So these are the problems. And also, there's a new thing called shisha.
Should I decide to take just a little bit in moderation, does that affect me? Or maybe as with most drugs, the issue of tolerance, because I think also it would help, our students and our young people understand that sometimes when you make a decision to take something.
Now you have stains in your tooth. So what you can do, you cease, you stop taking tobacco, you stop smoking, and then you keep yourself clean. Try to lead a healthy life, do a little bit of exercise, try to take healthy food like fresh fruit, veggies, all these, and avoid taking sugary and carbohydrate more in late night. Rather finish your dinner early, and then make a healthy choice of brushing at night and then go to sleep. So this way you can change your pattern of life, what you used to do earlier, and then you can make it better. The problem is when you do the wrong thing, the damage is huge. But when you change your life and want to make it better, then it takes a long time. But you have to have the patience and start slowly to do the right choices, make the right decisions and healthy choices, healthy lifestyle, and eventually it will get better. So nutrition fact is important to help you heal your things. And another thing I would like to add, using a little bit or more, but the main thing is continuation. If you take it every day, that creates the main problem. And if you take more, that makes more problem. Okay, so try to reduce and try to stop. Okay, regarding apple cider, it's a harsh chemical. It's rough on your tooth. So if you have, because the thing is, when we are cleaning our tooth, when we are brushing our tooth, we need something foamy. Something foamy that does not erode the enamel. As I mentioned, alcohol, which are acidic drinks, that creates erosion of the tooth and makes it sensitive. Yes, vinegar cleans these things, but our tooth, we need to eat with our tooth until we are 80, if we live enough, okay? So if you start rinsing with the vinegar when you are 6, then what will remain in your mouth when you are, say, 20, 30, 40? It will erode. So as I mentioned, if we want to drink a chilled pineapple juice, I would say, ouch. So when somebody is sent to the rehabilitation center, usually in a standard procedure, they are taken there for the treatment and while they are staying in the rehabilitation center, because every day they are having problems with tooth, like toothaches, broken tooth, and tooth loose coming out of the mouth, and this type of things do happen every now and then. So they are taken to the hospitals and clinics and treated there. But I can tell you, those who go to the rehabilitation center and those who come to us through rehabilitation center for treatment, the prognosis is not very good. A lot of tooth has to be extracted, and the treatment procedure. Another problem with the people with drug and alcohol is that you treat the person, but they don't maintain it. Today you put a tooth filling or something, and the day after tomorrow he comes to you with the broken filling. What happened? Because they had an accident or a fight with somebody, or they just fell down or something. Even they don't care because of the effect of drugs on their brain. They don't know how to maintain it.
I just want to appreciate you, Dr. Shegufta. I think this has been a wonderful webinar. I think this is helpful mainly to our students and maybe even to their peers, as we've seen a rise in drug abuse. A lot of young people are engaged in abuse that came shishas, and of which it even also affect them mentally.
Okay, as I can see one, I will discuss about this toothbrush. Can you show the toothbrush more clearly to the camera, please? Okay, so what I was expecting, this one, that's good. So what I was expecting that some people, when they come to the dental clinic, they show their toothbrush and I ask them to bring it. The toothbrush is supposed to be like this, but it becomes, the brush becomes like this. Do you understand what I mean? Okay, so if the toothbrushes, the brushes of the bristles, it is called bristles that we brush with in the head. So if the bristles become like this, rather than become like this, then we have to discard the toothbrush. Okay, all right. So there is a time limit, like 3 to 5 months, we can use a toothbrush. And if we take care of it or brush softly, then it remains good. But if we brush too harshly, then the bristles become separated and spread out like this. And it does not perform perfectly. That's why I wanted to see the toothbrushes. These are all quite good, but this pink one, I think the pink one needs to be changed like after a few days or maybe 1 month more. But still.
Yes, can you share on how on what home remedies we can use to get rid of bad breath? Bad breath has become a serious problem.
Okay. Wow.
Please help.
Well, Shukula from Empower Me First College, one of the students of Empower Me First College, has already discussed it in one of the YouTube videos. I saw it and it is so beautiful. The video is good and her saying about it with passion, her movement, everything so confident. I really liked it. And I discussed earlier in the session today that she mentioned about rinsing your mouth with warm water. And I advised that why not add a little bit of salt with the warm water to rinse. Another thing about spice. Do you know about clove? Clove, do you use it for a spice?
Yeah, sometimes.
Okay. So for bad breath, it is not a, it is a herbal remedy. It is good. You take one clove, you can chew it, and you can keep it a little bit while inside your mouth, and it will give you a spicy flavor inside the mouth, and it is also good for your oral health. It's not bad, but keeping it inside the mouth and in one side, in the same side, releases the spices and it may harm a little bit. But if you just keep it for a while, or you can take boil water with clove and then rinse with it. Not the
ground, you find that alcohol and these drugs, they are very, very affordable. They are even cheaper than, most basics.
Mm-hmm.
So, it's hard to tell people stop right here and there, and then no matter how much we get the word out there that, this is bad. I think one way is to make drugs and alcohol too expensive. So automatically when it's too expensive, people cannot afford. Because you can imagine if a small stash is equivalent to a bar of chocolate.
One of the things that could probably help us, even as students, would be to kind of like get a first-hand look at what drugs are doing to people. Sometimes you actually have to go see. When we've been talking about oral health, like firsthand what it does to you. When you see, I saw from the video that was shared before, when you look at the mouth of, a smoker and stuff like that. And I was actually next to one of the students and, they're like, this is bad. And to me, it felt like if we really have our students exposed and kind of see these different scenarios. And I remember talking to Natasha the other time about, the bad decisions that, young people tend to make. And she was talking about if they had an opportunity to see what prison is like and how, what really happens there, they wouldn't really be more involved in these kind of drugs and issues. I think also that exposure helps create that awareness.
Thank you so much, Bridget and Shegufta. It's been a wonderful and powerful webinar. We really appreciate it in Zimbabwe. It's really rich, and we are hoping for more. Bring us more.
Yes, I'm really thankful that so many people joined, although they're joining through one device, but their number and their interest, their curiosity, it really moved. And thank you so much. I would like to clap a little bit for all the participants joining.
Education is the key to a bright future.